So when we think about the similarities, in terms of preparation, initially it's going to look very similar. With amniotic membranes, it is coming from donated placenta tissue. So they're collected from mothers after consenting to donate their placenta after full term cesarean births. Now, after that process, they're going to screen the tissue extensively. They're looking for any kind of infectious agents, contamination, very similar to blood donation. After that is screened, what they'll do is they'll separate the placenta and take the amnion layer, which is the inner layer. The reason that we're using amnion is because it has a lot of healing properties, anti-inflammatory agents and growth factors, the things that really we're using as a biologic to help with healing. After that process of separation, they're going to go ahead and wash the tissue and test it again for any residual infections, bacteria that might be present. At the very end, they'll sterilize it again using some gamma effect there. Now, when it comes to the differences, we talked just about how it's similar in terms of getting the tissue itself, but when it comes to then processing on and storing, this is where dry versus wet comes into play. So, dry membranes are what we refer to as dehydrated membranes. They're going to be air or freeze dried at the end of the process, and it's going to be under sterile conditions. But the benefit of it is it can be stored at room temperature for longer periods of time. The downside in this preparation process is it means that we may lose some of the cellular components over the process, but a lot of the structural proteins remain that help with those signaling pathways for healing. When it comes to preparation then of wet membranes, or we also call these cryopreserved membranes, they're going to use a cryoprotectant solution. I tell patients this is like a very, very strong preservative, but the goal is really to keep as much of that live cell intact. It's also going to be stored at very cold temperatures, about minus 80 degrees Celsius. And that's to protect all the live cells and bioactive molecules that are in that tissue.